Chronic obstructive disease is the name of the group of chronic diseases, as they call complicated breathing. This is a common term for two conditions, emphysema and chronic bronchitis. Patients can be the mother of one or be offended by these pathologies. The main reason is the influx of waste particles or gases, most often cigarette smoke. Other factors include infusion of doe-kill, for example, professional saw and chemical speech, obstructed air indoors and on the street. Genetic factors, including alpha-1 antitrypsin deficiency, genetic factor. Other factors, such as respiratory infections in childhood, socioeconomic status, and, possibly, genetic diversity. Symptoms. Chronic cough. The cough may be intermittent, or it may become permanent. Visions of phlegm. Increased secretion of mucus, often with phlegm, especially in the frenzy. The back of the kidney is under an hour of physical stimulation, and then at rest, if the illness progresses. Wheezing and chest tightness, often due to bronchial obstruction. Secondly, through an increase in strength necessary for breathing, and a decrease in blood saturation with acidity. Parts of respiratory infections. Treatment of chronic obstructive disease is aimed at relieving symptoms, reducing the risk of life, preventing and treating illness, as well as reducing the progression of disease. Prevention of chronic obstructive disease in the lungs involves changes in the flow of risk factors. The main preventive approaches include open fire. The most effective way is to not start burning at all. It's important for the curts to stop firing. Change of occupational exposure. Improved protection and provision of adequate ventilation in work areas with saws, chemicals, and steam. Reducing obstructed air to a minimum. Eliminating obstructed air and vigorously purifying the air in the area can help to reduce the influx of stubborn obstructed water. Prevention of respiratory infections. Vaccination against influenza and pneumococcal infection. Maintaining hand hygiene and avoiding close contact with sick people. Detection and treatment of early signs of pulmonary disease, especially in individuals with risk factors, can help prevent the progression of chronic obstructive pulmonary disease. With proper treatment, most people with chronic obstructive diseases can achieve good control of symptoms and daily life ailments, as well as reduce the risk of deterioration. Before treatment methods. Pinned Tayutian Opal _NYA. Dosage of physical exercises, dihal gymnastics, pharmacological, drug, treatment, Kisneva therapy, surgical treatment.